Good morning. Welcome back to House Human Services after a brief break. Welcome to the hot seat, Deputy Commissioner Gray. We are going to move into economic services / reach up and all of that. So one of our budget team members will be back shortly, but we want to keep things moving along. So welcome. All right, committee. This is first. I offer you an opportunity if you have anything you want to open with or anything like that before we just delve into questions.
All the pressure, right? Yeah. Please stretch. Just thank you. I appreciate it. I'm open to any questions that you have.
Okay.
I did introduce myself for the record before, but I have to do it again. Miranda Gray.
Okay. Thank you. Thank you so much. Obviously, some of the impacts of what we're seeing in terms of the administration's housing proposal have an impact not only in OEO, but also in economic services. And I think that before we get into that, I think we'll talk a little bit about Reach Up first, if we could. One of the things that we understood from reading this handy dandy book, and I wish you could hopefully explain it a little bit more, which is the elimination of the Reach First. And what you said in the book was that essentially you felt like you were going to be able to incorporate those folks within the Reach Up appropriation. And I just want to make sure that that's what we're interpreting correctly. And then if we're not, you will let us know.
Absolutely. And yes, so the folks would still be eligible for regular Reach Up. And it really just eliminates administrative burden. Reach First was a very underutilized program. I think we have on average 15 cases a month. So it was very small. And the same eligibility requirements to get into Reach First exist for Reach Up. So those cases will be able to be on our regular Reach Up caseload.
So I think maybe it would be helpful just if you said in a couple of sentences what Reach First was intended to do and why it was separate to begin with, so that we can understand what we're losing.
Yeah. So it was a short-term kind of diversion program for people who had employment maybe or something else to go back to. So think unpaid family leave, for example. If someone didn't have family leave and didn't have any source of income, they could come into Reach First, knowing that they would be able to return to their employment after that point. And so the same thing, they will be able to access Reach Up for whatever duration it was that they needed.
So I'm trying to figure out how is that eligibility different? It seems like it was established for a particular purpose, right. But that's what, so not only the people, but what was the particular purpose for which it was established? And I'm just going to warn you, we have a historian with us.
Okay, she'll keep me honest. It does create my time. But
I was there.
You were there. Okay. I was not.
Me either. So
I think there was an option for people, like if you didn't need the monthly benefits, then you could get all 4 months at one time. So like if you really just needed more of like a lump sum to help get you through. But really it is that you can still get those payments. It will just be over the course of months. But I think most people, and I would have to go back and see if we could look at this, is like, were people getting this like upfront lump sum, or were they just getting the monthly benefits, which is what people are accustomed to in the Reach Up program. That's what
how's your understanding? Okay.
Yeah.
Not in terms of the purpose.
And we're hearing you say that utilization has been down, but I know we sort of ran into, some disagreements last year about this program as well, and where we made a concerted effort to continue it for at least one more year. And wasn't it?
That was Reach.
Oh, that was Reach Ahead.
Yes,
Sorry.
Thank you.
Thank you. That was wrong one. There's so many reaches. I know. Okay. Thank you. Go ahead, Representative Bishop.
So it's good to see that the costs can be absorbed, but I guess there's the cost and then there's the program intentions, and it sounds like again within Reach Up generally, these needs can be met, but if the focus isn't there of having the Reach First program, will the intentions be delivered upon even if the money is there? Is that making sense? Just because the money's there, if the program isn't, I'm concerned whether the goals are still going to be met in the same way.
So you still have access to a case manager where we would be talking about like, what is your goal? And is it short term? Do you have something to go back to? So maybe we aren't helping remove a lot of the barriers that we are with our typical Reach Up case. Like maybe you need lighter touches, but you still have access to the support services, which is, something that, is helpful to help people, like maybe have a car insurance payment that you aren't able to make because you don't have all of the income that you're used to having. Is that?
If someone was accessing Reach First, was it an easier entree into the system that's now going to be a little more complicated if you have to go through the full Reach Up process? No? Okay.
I'm sorry, go ahead. I was doing some technical things. Go ahead and then we'll go to you.
So I think what's important to understand to make sure that we're not losing something by ending it as a distinct program is what the purpose actually was. And it was the primary purpose had to do with avoiding a potential massive loss of federal funding. And in the process of creating a system to avoid that, we discovered we could do something really positive programmatically for the people. And if we're keeping the programmatic purpose, which it sounds like we may be, we need to make sure we're also not losing the protection against loss of federal funds that was the origin of both Reach Up and Reach First. So just really briefly, at the time, the Welfare Reform Act had gone through and it had to do with work requirements. The percentage of people who needed to be on work requirements to avoid a significant federal penalty. And the biggest problem was the baseline for seeing if you were improving that was your current baseline. So if we in Vermont, pick a number, were 90% effective in getting people to work, and other states were 50%, we had to go to 95% and they had to go to 55%. And going from a high rate already to an even higher rate would be really, really difficult. So the way we developed to achieve it is say, we want people who are working to stay on VCF longer so that they can count as part of our work participation being on the program. And we want to keep people off who would not contribute to our work participation and yet still give them the help they need. And in fact, with Reach Forward, Reach Ahead, the actors, providing some really additional assistance that will help them exceed by providing a little bit of cash assistance after there would be off. So, and the Reach First, getting them the cash assistance so they don't have to go on the program when they're not working, because we get them back on track without getting them on the program so they don't reduce our work rate requirements, and then Reach Ahead improved our work rate requirements. So that was why it got developed on Valentine's Day of that year. Because it was the night of the Valentine's Day blizzard, and we had two consultants from Washington, D.C. helping us who had flown in, and they had to go back, and the snow was dead. So we stayed till 11 o'clock or midnight in the snowstorm on everybody else had gone home in order to, but that's an aside. So my concern, because it sounds like you're trying to be very attentive to still meeting those families' needs that we addressed when we created this program. But my concern is making sure that it does not harm us in terms of the importance of that work participation rate, which I think in the latest administration and all, there's even more pressure on that, ensuring that work participation.
So, so it was essentially, how do we keep people out of our denominator? And most folks aren't, I don't know, is that 4 years ago now? Maybe it's just 3, right? We moved to more of an engagement model in Reach Up. So people actually meeting the work requirement isn't the focus of the program. And most of our work participation is purchased through.
But don't we need to be attentive to that for purposes of federal law and not losing federal funding?
We might need to refocus under this current federal administration, and which is something that we are keeping top of mind of. We went in a direction, but is that a direction that we're going to be able to continue in the same manner that we are? Or are we going to have to become more of like we are counting what people are doing in meeting hours, which is not what is happening currently. We're still working with people, but the counting of hours, like being in community service placements, that was moved away from. So it is definitely something that's top of mind, but I don't think because these are the 15, 15 cases that would be where our
It's not going to impact enough to in any direction.
And I would add to that we have had an increase in our available funding for our maintenance of effort because of Act 76, which invested a lot of state funded dollars in eligible activities, which has allowed us and will allow us to buy down that work participation
Well,
rate.
was Act 78.
Yeah.
Thank you.
76.
Yes.
Yeah.
76.
So I think that there's also been that, which has been a bit of a confession release valve on the work participation rate.
Thank you.
Thank you. Yeah, looking at the absorption idea here with Reach First and, the relative caseload adjustments for Reach Up in general. So that's an interesting, if we're planning to absorb more, but we're reducing for caseload adjustments, that's kind of, I don't know, I'd love more to the story there about why we're doing that.
So we take a projection based on caseload, and we feel that there's only our average has been 15 cases per month, right? Which is a very small number. And we feel like we have the capacity within our projected caseload for Reach Up next year to absorb those 15 cases per month.
So Reach First folks were included in that calculation.
Yes.
as well. And with the cut of that program, would folks need to re-enroll into the other version of Reach Up? Would there be an administrative aspect to that, or
No,
would they
they can
automatically?
already roll into Reach Up seamlessly.
Okay. Thank you.
You're welcome.
Okay, any other questions on Reach Up? Go ahead, Representative Steady.
Does Reach Up pay for car repairs too?
We can, that is the support service that we can support people with.
Okay. Thank you.
You're welcome.
Go ahead, Representative Cole.
Sure. One more question here, which has to do with the Social Security supports. So helping people apply for Social Security benefits. This kind of came up in Rep. Noise's question earlier with the eligibility for other funds, age blind disabled funding source. And I mean, it's just it's a problem that I see over and over and over again is, I feel like we are sort of dealing with the consequences of people not, even if they're duly owed SSI, SSDI, whatever barriers are existing for them to be able to go through that sometimes arduous process of acquiring those. Gets, there, we need to kind of make up for that on the state end, whether it's in a GA hotel room, whether it's in, Reach Up, whether it's in wherever. So I am, at first glance here, concerned that that's not something that's being utilized. And, because had I known about it when I was supporting certain individuals in the hotel rooms, that was exactly what they would have benefited from. So I do see this, it could be a great cost savings for us to provide better supports. And I'm just curious about the nature of what we are doing as, an agency right now to support people in acquiring that SSI, SSDI, or are we just kind of telling people that that's just their job?
That service wasn't for those in the hotel program. It was for those in the PNI ongoing GA program. So that's why you're seeing that disconnect. And I think, it is like people needing to have case management. I oversaw the Social Security agreement many eons ago. And one of the reason that initially we had success in GA, but it wasn't ever those in the hotel rooms because that was a very time limited. I think now you're just seeing people that are longer, but we had more success with those in Reach Up at the time because they had a case manager who was just like, we need to be able, the social security specialist would say, like, we have to show that they aren't able to work. So can you set them up in a community service placement and see, like, with supports, are they able to be successful or are they not be able to be successful? Can you help them in organizing their medical appointments, whatever it was, because these agreements are truly just folks that I think used to work for Social Security Department now happen to work for the Vermont Association of Business and Industry Rehabilitation. Sorry, the R always gets me vapor. And they worked in that system, so they know, like how to gather documentation. But we were finding that it still wasn't getting people to that landing spot, but it wasn't for those in the hotel program. I know it's not helpful, but that is just the reality of where the resources were.
So that Representative Cole, following up on that question is kind of overlays a lot of different programs around outreach to outreach to the public about potential eligibility for assistance, particularly in times when the cost of everything is increasing for all of us. That came up in SNAP. It's going to come up in Medicaid. It's going to in also, I guess across a variety of different programs. And maybe you can describe for the programs that are in your responsibility, Deputy Commissioner, how do you extend outreach to the community, sort of in general, about the various types of assistance that they might receive from government, on a short term or even sometimes a longer term basis?
Yeah, so in some instances, we have other organizations that we contract with. So I think of SNAP, we have SNAP outreach partners who, just because the federal law is a little bit tricky in terms of we can't look like we're recruiting people onto the program, but it's important that Vermonters understand what they may be eligible for. And so that's something that, like Hunger Free Vermont, they focus that areas of aging, can't never get that one, the AAA.
AAAs, yeah.
Thank you. Right, like we ask them to make sure that they're reaching their populations to share what they might be eligible for. I know this is something that has come up for our regular general assistance caseloads, so not those necessarily in hotels, but the P&I, the personal needs. And so that is something where I have taken that feedback and we are working to get a website made that would be similar, more user-friendly. I know everybody, almost everybody, probably everyone in this room goes and visits our hotel and motel data spreadsheet, webpage. So how can I make sure that we have something that is similar? And then we do have, for fuel assistance, same thing. We have the community action agencies who are a partner there to help put out that information, what you might be eligible for, who else is already coming into their services, and they can explain that we have ongoing fuel assistance and then we have crisis fuel. So that's really how we do our outreach, but certainly open to thoughts if people have. We go to fairs when we're invited to go to those. We have people here today about SNAP Awareness Day.
I was.
Yeah, great.
So I guess, and I'll get to you just in a moment, Representative Steady. One of the questions, we have also been approached by, sort of a coalition of community providers about a request to provide additional support for, what they're calling assisters. I think I finally got the name right. It really cuts across multiple areas of the agency, human services, from healthcare to food insecurity to housing, goes to childcare, a wide variety of different community partners. And was there any consideration, giving the changing landscape of what federal requirements are now shifting to for current beneficiaries, whether additional support to those community partners would be beneficial for Vermonters?
So I think we have engagement, and I will say, just so I have the opportunity to thank you to our partners, because this fall we did need to have everybody to be able to make sure that we were getting word out. And I think we worked really well together doing that. So I'm not sure if there is an additional need or not. I think those would be ongoing conversations. Clearly, they're telling you that they are, but I haven't had the opportunity to look at like who exactly is asking for that. And is it the same folks that we already have or not? Is it someone new? And so we would be being asked to essentially shift that expertise elsewhere, which can also be tricky, especially during.
I think they're mostly all people that you know. All community partners that you're familiar with. Okay, so what I'm hearing you say is that you didn't identify that as a need.
I mean, in terms of,
Additional community outreach
Right,
during these
additional.
changing times.
not additional.
Okay, thank you. Representative Steady.
When I worked for DCF, Housing the Homeless, I found this as a concern back then, and the people in the DA motel program could apply for fuel assistance. Is this still happening?
It probably was the $21 benefit, which is phasing out, like federally, we aren't able to do that. And there is statute that I can share if you're interested, where we're essentially removing that just because we can't get that benefit. But they weren't actually getting like a fuel assistance delivery benefit, if that is helpful.
Like a $21?
Which $21, which would help them get the max benefit in their 3 squares.
Is that what it was?
Yeah.
I
It's a-
knew it was happening. I just didn't know why.
Yeah.
Thank you.
You're welcome.
Okay, let's move to 3 squares. Speaking of which, so we see a caseload increase, which we had also seen in BAA. I think that speaks to the issue of food insecurity in our state. I have a quick question about, well, I think it's quick because I keep asking the question, and eventually I'll get my hands around what is really the answer around the administrative aspect of it. And so I get that it's prorated, and I get that when I asked this question downstairs in appropriations, that it really was considering a number of multiple elements that went into that calculation. Was that calculation being based upon, somebody told me today that they thought that was being based upon FY24 administrative costs.
So 3 squares is all benefits. Our 3 squares.
I mean, in the admin, you know what I'm talking about, the admin part.
So you're talking about this, the
I realize that the 3, whatever number it is, 322 is all the public benefit. Yeah, I'm talking about the
So
administrative.
you're talking about the Fed fund to GF swap.
Yes.
So that was based on 25 actuals. So we ran the cost allocation program, which is pretty, complex program. And we saw how much was allocated to our SNAP admin in each of the buckets. And then we took half of that and we said, well, we're going to need, half of that as GF moving forward, at least. And so that was the only way we could really come up with to accurately project the impact moving forward. But it was based on
FY25.
FY25, which
Would have been
the best information we had.
Yeah, okay, that's helpful. Does anybody have any other questions on 3 squares / SNAP? Okay, yeah, go ahead.
Sure. I mean, I think just to draw attention to the fact that, this $2 million appropriation is strictly for the elderly and disabled populations. Like, this isn't even the general public talking about 3 squares and increased enrollment. Like, this is a very specific program for that. So just to highlight again, it's the population that we're talking about.
Thank you. Okay. Well, trying to make sure, did you do LIHEAP already? No, I don't think there's any big questions in LIHEAP. I'm avoiding the big ones, so.
That works for me.
I know.
Yeah, I was like.
I'm trying to get out the miscellaneous ones first, okay? Any questions about LIHEAP? I appreciate understanding that, the money is flowing and people, thank you for your efforts to make sure that people got it in anticipation of the federal funds coming in. We know that timing isn't always great, and Winter Vermont comes whenever it wants to come. So thank you for your efforts in getting that out. Okay, did I miss any that, other than the obvious one that I'm going to go to now, but age blind disabled. Okay, I think I'm good. All right, so moving to general assistance. We've actually already talked about the Social Security agreement cut, and the impacts on that, but I didn't know if you had any additional questions that you wanted to ask about that. Not right.
I mean,
Yeah,
yeah,
I need to absorb that a bit.
Yeah.
yeah.
Okay.
I think it's just, for some reason, the connection isn't happening. Like, people who really need that support are not acquiring it. And I think we could even have people with more sustainable incomes that could perhaps stop needing shelter even because they had that connection in the first place. So, because anyway, that's just all. I think it's a preemptive measure to avoid the emergency situation.
I appreciate that for sure. So in the housing initiative and moving the 7.45 million out of base into one time, does that leave anything in base in there?
It does leave a small amount. It's, I can, so for it, so we leave 2.7 million in emergency housing in the base appropriation for hotels and administrative costs in state fiscal year 27,
Sorry, how much was that?
2.7 million.
You said hotel and administrative costs? Administrative meaning what?
The positions needed to administer that eligibility determinations.
Is that the 21 positions?
Yes, it's the 21 positions. Let me pull up my other sheet. Too many spreadsheets.
I'm impressed that you can locate it, frankly.
So it is the, yeah, I'm not locating it, it's the problem. Okay, so, it's, what remains in there is just in GA, other than the positions in admin, is just for the contracted, hotels. Which is $550,000.
So the other 2 million or almost 2 million is for admin?
For the 21 positions, correct?
Can I ask a question?
Yeah.
I'm not sure if we're strictly GA or we can talk about the housing initiative or.
It's all rolled
Oh,
into, it's all
yeah,
sort of
okay.
rolled into one, but we haven't actually moved any, we haven't done anything in OEO yet, so it's,
Okay.
it's, I just, before I, move to that, or maybe you go ahead and ask your question, I'll ask it for you, go ahead.
Yeah, so I noticed this, I didn't realize that that was gonna remain just most of the GA budget. That we're creating, this proposal is we are for eligibility determination, which is a self-imposed barrier that our state has made. And it's often, we have these subpopulations more than we're allotting to entire populations. Just for example, 62% of GA participants have a disability. And we're, well, first, the word disability doesn't appear in your housing initiative plan at all. I looked, it's not in there. And I think that's a problem, considering 62% of just the GA people in hotels have a disability. But we're allotting more to admin than you're allowing for services, but now it makes a little more sense, I guess. So I guess my question is, how did you arrive at these population breakdowns? And how many, like the amount you're funding for each of these population breakdowns? And I guess I'd also like to know, like, what other buckets of admin are there related to this housing initiative beyond the 21 new positions?
So I'm going to interrupt just for a second. So we'll get to your question. I'm not sure we have a clear understanding about what these 21 positions do. Since they're in the GA, it doesn't make, something's not computing for me that we would spend $2.1 million administering a $550,000 program. So I'm sure that that's not the case. if you could explain what these 21 positions do, that would be great.
Yeah, there were several misconceptions that I think we can clear up if we go through the slide presentation we have for the housing initiative.
But you have a new slide presentation
Yes.
for the housing initiative?
Yeah.
Okay, sure.
Did you have something? you
Yeah,
wanted-
I was just gonna add that while there's 550,000 in the base remaining, there is 15 million in one time, so it would need to be administered also by staff.
Yes, I get that.
But not all of the 21 positions are doing eligibility too. There are other things in those 21 positions.
Great, so we look forward to seeing what that is.
Can we do that now?
Yeah,
Okay. So just to address the first, well, part of what you were saying is how did you come up with these numbers? I can tell you that the team has been working for at least a year looking at what the program looks like now, who's being served, and then working with providers in the community to understand where the gaps are, and then come up with a plan to address those gaps and work to create a system that's improved for the people that are being served and the communities that they're being served in. So, I think, okay. So this additional shelter capacity, we want to build that. That's the 5 million carryover plus 6 million. So it's 11 million total. And we would be looking at building 6 additional shelters serving about 240 households. And they'd be regional based on needs. And we figure 40 households served in each. And the programming is determined by the need of that specific area. And then mental health services would be provided in this shelter. So this is something that we heard from the providers that they needed vetted workers in the shelters. So 250,000 would come out of that 11 million to
That would
provide
be-
those services.
Would that be contracted with DMH or designated agencies or?
DMH can talk more about that, if that's their program. That's why Deputy Secretary LaFleur is here too, because it is an agency-wide initiative. So DMH could speak more to that, what it would look like.
And when you say 40 households served in each, do you mean 40 households at one time? Do you mean that these sites would be large enough for 40 households?
Yes.
That's like a small hotel. Okay. No, we have ventured into your area, Lily. So yeah, just, for people who speak from the side, it's helpful if you just say your name, because not everybody who's in, Zoom land can see us, especially with the PowerPoint up. So, Lily, go ahead.
Absolutely, my apologies. I'm Lily Silverman from the Office of Economic Opportunity. We do have some shelters of this size now, and I'm happy to follow up if that's helpful on more information about shelter capacity or size range, depending on what questions you have, but I know there's also a lot to get through here, but we do have some of that size.
Okay, thank you. And, go ahead, Representative.
So my understanding, this is to build and to create the shelter. Do you have an estimate of what the ongoing, so like next year or at the BAA, what you're going to be what it's going to cost to operate the shelters on an annual basis?
Yeah, so we have a range, and again, with this proposal next year, we really want to do some targeted outreach. I think again, a range for a base impact per shelter could be $1 to $1.5 million for operating a year. Obviously, there's quite a bit of difference in terms of operating costs by region that we see. So again, just take that as a range for future base pressure.
But I guess my question is, I know currently that shelters don't necessarily receive 100% of the funding necessary to operate a shelter. What would you be anticipating the pressure on the state general fund? Are you anticipating providing 100% of the operating costs, I guess, to these new shelters, which is not customary for the current shelters, as I understand it?
I think that would be the range that the administration is anticipating would be the base pressure we would be
between 1 and 1.5 million per shelter. And I realize this is in advance of actually doing this, but what would be your plan to do that? I'm not expecting a big windfall of additional federal funds to help us with this. Are you anticipating reducing current levels of service in other areas in order to accommodate up to, $6 to $9 million?
Not sure how much to get ahead, but I don't know.
Yeah, the record-
McClure.
Crystal McClure, Deputy Secretary, Agency of Human Services. Certainly understand where you're going, and we are projecting a base pressure in fiscal year 28 of about, 6 million, a little over that for operating costs. But I think it's too early at this point to forecast what would potentially offset that.
I appreciate that. I think that, part of our concern arises from some of the decisions that were made in FY 26 around transferring some supportive services from from other HOP funding into other priorities. I understand that. At the same time, as a legislative body, we have to have some sense of what, if we agree to something like this, what we are committing ourselves to in the future. I think that's part of the reason for needing to have some sense of understanding. So I guess that what it sounds like is at the most, it would be between the 1 to 1.5 million, but there might be offsetting costs. Is that fair?
I think it's too early to forecast
Okay,
fiscal year 28 at this point.
okay. Any other questions on this slide? Go ahead.
Oh, just to clarify, so this is the big overview, which includes your subsections of recovery shelters and medically vulnerable. Okay, so this is like the headline for the following slide. Okay.
And so the 6 million is one-time investment that's separate from the recovery shelters and the other components. This is
So this is,
the first component.
oh, this
Penny.
is separate. This is not a headline.
Yeah, they're separate and there's
Okay.
separate healthcare ones too.
Yeah, okay, thank you.
Okay, so now we get into the special populations, one being recovery-oriented shelter. So the 1.2 million here is the maintenance of a 12-bed shelter in Burlington with a targeted opening in March. And then investment in potential third recovery-oriented shelter, which would be jointly administered by BDH.
And so this is base funding, I'm presuming, since it's ongoing. So, and this shelter is, it says maintenance of 12 beds. So is that something that's been developed recently? It says it's opening in March, done with FY 26 dollars in the HOP program, I'm presuming, or one-time. There was some one-time shelter development money, I recall, in our 26 budget. That's where part of this went. Okay. And who is operating this?
Champlain Valley Office of Economic Opportunities.
That's it.
Yes, go
Do we
ahead.
have any idea what the third one, what the capacity will be?
Not at this time, and we're working with the health department to assess kind of community readiness and what would be a good location. This model really works when you have a community that has, the population to meet the need, because it is more of a focused program, and also other shelter capacities, so that there can be a nice referral in, and then, if necessary, a referral out, as opposed to then having some of the shelter situation. So we're working with the health department to make sure it's in a community where it will be utilized and there's readiness.
I just have a question about the second bullet, just phrasing the investment in potential third, jointly with the Vermont Department of Health. So are they investing anything like from their, it's all one budget, but is there additional money kind of in another budget presentation anywhere, or is this 1.2 million what's being directed for those? Okay, for both those two things.
And so how much of the 1.2 is operations and how much of it is investment?
The majority is operations. I would say
So-
2/3 to 3/4 is operation.
Would you be able to get us the actual kind of amounts or what your approximate need?
We can share the current
Yeah,
budget.
yeah, and I know costs change a little bit, so it's not firm.
Yeah, it's next month though,
Yeah.
so I mean, it should be pretty nailed down.
We have, again, we have those solid numbers from the grant meetings that are currently in place that we can share.
And so is this anticipated to provide 100% of the operating costs or a portion of the operating costs?
I think this was for the Housing Opportunity Grant Program, along with many state funded programs, right? There's an annual procurement process and review. I think this is anticipated to cover a bulk of the costs. I think as the dynamic was shared earlier, right? Sometimes we go through a negotiation process when we receive grants, if people are sort of asking for things that seem out of scope or seem beyond what we can afford, so I don't want to.
But it's not like 50% of the costs that you're expecting.
Yes.
Okay. And I guess what I'm trying to understand, and not, obviously not, the legislature is not part of the Housing Opportunity Program, RFP and grant process. So I only know from what we hear from witnesses. So I don't know the difference, I guess. It appears to be, I guess, what I'm trying to, sorry, I'm not being very clear in my own mind, but what I am wondering is if we are setting the program up for additional requests from other shelters that do not receive this type and level of funding. So they receive much less funding. And I have a concern that we might be setting ourselves up for this inequitable balance about shelter operations is my concern. I'm seeing your head nod, so I think it seems like there's, and is it, so are you providing this level of operational funding because you are trying to incentivize folks to develop the shelters, or because you're saying, we really need to do this and, well, I guess that's an incentive. I'm just trying to figure out what, sort of what the thinking is behind sort of what has been traditionally been done around shelters. And then now, because again, this is sort of setting us up for additional legislative appropriation requests that we should understand.
Yeah, thank you. I think, the administration shares a commitment to address these needs, and over the past few years, as we have worked with our community providers to bring on significant new capacity relatively quickly, we need to make sure that they have operating costs. And I think for a lot of nonprofits, it's challenging to switch some of their private fundraising or, alternate grant applications as quickly as we've got on these new projects. And I think that's where you do see a little bit of a difference between maybe some historical projects that just over the years have had a more diverse funding stream. And so I think that is an observation of, to respond to the urgency, the state has been covering more of the cost to help them get up and running, because we can be more responsive than maybe the ability to the ability to go after other federal or national funding sources. So that is, I think, the dynamic of the past few years that we shared that observation.
Go ahead.
Is that 1.2 million the request made by BDH to the opioid settlement advisory committee?
No, that, this year we have received opioid settlement funds to support shelters across the state as they respond to what they see in shelters regarding the impacts of substance use disorder and opioid. So that covers for, again, all shelters across the state were able to apply for those funds. Staff training dollars, additional staff supplies. For instance, sometimes you see the need for more kind of first aid supplies. Also, one-time kind of supplies or investments. So for instance, overdose prevention sensors. So these are, for instance, in bathrooms where if people are not moving, that would sound an alarm and create a staff protocol response. So that is a separate statewide effort that any of our shelters can apply for funding to support those types of activities.
So again, this $1.2 million has nothing to do with the
That's correct.
Vermont Department of Health's
Yes.
request for opiate settlement monies for startup costs and new recovery beds and investments in that.
Correct.
Okay, thank you.
Go ahead.
I think I missed something while I was making notes here. There's talk of 12-bed shelter in Burlington, and the next bullet point refers to a third recovery shelter. Where's the second one?
First
Oh,
one.
thank you, great question. We kind of jumped to the second one. Burlington's the second one. The first one currently exists, is administered by Good Samaritan Haven in central Vermont.
Okay.
And in Southbury, I think technically is where the address is. But so that's been operating for a few years now with joint support between our office and the health department. And then that's what has sort of then led to, okay, this seems to be working well. Where can we expand this model? Burlington, again, because of population and the other shelter capacity is like natural fit. We were able to work with local providers. Again, hopefully they'll be up and running next month.
How many beds in,
And Barry,
Okay.
13.
thank you.
Yep, thank you.
Another question, because this is operations funds at this point in time, most of it anyways. So when, on the previous slide, when we were talking about the other new proposed shelters, we were talking about operational expenses in the out year of 1 to 1.5 million for 40 beds per facility. And we're looking at, roughly the same amount for a 12-bed shelter. I'm just trying to figure out, and I realize that there's some, specialized supports for folks in with substance use disorder. But that's also addressed in the previous slide with that 250,000. So I'm just trying, there's a big differential between 40 beds and 12 beds for roughly the same amount of money operationally that, you were talking about. Can you explain that?
Yeah, so again, I think the 112.5 is an average across. I think we see tremendous operating cost differentials between Chittenden County and other parts of the state.
Mhm. Mostly in real estate and salaries, or
Those would be the two primary drivers.
any other questions on this slide? Representative Blume, any questions?
Yeah, I think that I have a general question, not about this, but just, what I'm not really understanding, there was mention of CDOEO, but, kind of where community providers come in and what work is actually being is it really, are we gonna draw on community providers to actually run these shelters, or is this are these state-run shelters? And will you be contracting out to new folks for that?
Sorry. Is that going back to the prior slide or this slide in particular?
No, I'm just talking about all
General.
these
Okay,
different shelters.
The community based providers that we have. And not state operated shelters.
Okay.
Okay, so now the next specialized population would be the medically vulnerable, and that's 2.6 million. This would be Dale administered program. And it may serve approximately 60 people with case management, personal care, skilled nursing, and this is the shelter providers stress this as a significant need in the system.
Go ahead.
I'm just wondering your language may serve. I just noted others are more specific on how many beds. Is that that's what you hope, or is it 60 beds for medically
I was trying to be approximate. Meg,
Approximate.
in all of
Yeah, yeah.
I was trying to be consistent.
And Representative Noyes?
Do you know who will be providing that case management?
I would say I would like our Dale partners to talk about this.
Fair enough.
I think you can anticipate that would be the AAAs.
And sorry.
Go ahead.
Is that, the 2.6 is for development and operation, like, is it startup and all in? Or is this just, operations?
I would again ask you to talk to our Dale partners about that.
Actually,
Go ahead.
let me jump in. For this one, remember we talked last week about a transition from where we are to where we're going. So we anticipate this will be part of the transition. So the medically vulnerable shelters that were mentioned here and was certainly highlighted by other shelter providers as a need, really specialized population because they need some clinical service. This is where like the final destination where we would like to go. There is likely a transition point, an interim transition point where we are still leveraging and utilizing the hotels and motels in a slightly different way for this population while we bring up these shelters. So I just want to be upfront about that we're not anticipating leapfrogging to that endpoint. There's probably a transition. And also in the budget, we estimate about 60 people would be served in that transition period, the hotel motel with services. So when we talk about our shelters and shelter-like options, it is all with services.
So I have a question particularly around this group of individuals and whether or not there's any possibility for federal receipts under global commitment, given the medical and healthcare related items that that we continually hear, as you do, that folks are needing. Has that been investigated at all? Do you know?
I was just gonna, I don't know, Commissioner Hammond, I think is maybe more poised to answer some of the direct questions, but I do believe Dale is considering a combination of general fund and then leveraging Medicaid and other services. So again, I think that Dale's gonna be able to get in the weeds with you.
Go ahead, Representative.
Do you have a definition of medically vulnerable you're operating under for this vision?
Dale does have that, and I believe last week they had shared that, but we can make sure.
Yeah, sorry. That would be great. Thank you.
And Representative Noyes, we'll do some follow-up with Dale as well around these questions. One of my sort of overall questions is these, again, is sort of picking up on what Representative Garofano said, is it development, is it operations, is it some combination? And Deputy Secretary talked about the transition period. And so would you be utilizing these funds flexibly, I guess I would ask, since you only have, you do have one-time dollars in GA as well. Okay, never mind that part of the question. I just answered it myself. These appear to be full year dollar amounts. So do you have, I guess what I would say is a transition plan about when you might expect these? Because I think there's probably an expectation that there might be some partial year funding, given that we expect transitions into some of these things.
We do talk about the timing around that. I think if being fully transparent, I think the team is probably a little more optimistic that they'll come online a little sooner than I am. So at some point, state fiscal year 27, but I think it's probably tail end, state fiscal year 27, that we would see them come online. And in the meantime, again, utilize hotel motel in a different way to bring in services for this population. So to really treat it more like a shelter, it's not going to be perfect, but provide more services in the short term while we get to this longer term solution.
Thank you. Go ahead.
Point out, New York State just mandated that all hotels used as shelter, for emergency housing, they have to provide the same services that are provided in shelters.
Well, that's where we're headed, so.
It's a trend.
It's where we're headed. Okay, thank you very much, Commissioner.
Okay, and then the next population is family sheltering, and that's 7.9 million. And we would use family designated hotels across 7 district offices, approximately 240 rooms. So this is where some of those positions that you were talking about, the 21 positions, would be in these hotels to ensure that the families are engaging in services and have access to services. They could leverage services from Higher Ability, DOL, parent-child centers, Vermont Chronic Care Initiative, DAs and SUD providers, substance use disorder providers. There would be authorized stays based on need and case plan, and there would be housing navigators that supported the families. So that's 876,000 would be granted out to community providers for housing navigation services. And the motel coordinator would act as liaisons between families and other providers, as well as ensure that engagement in services are happening. Engagement is happening.
And so of this 7.9, I heard you say 876 would go out to community providers. And then you said this is also the place where some of the staff. I'm still not quite understanding where these 21 staff positions, like, so what exactly are they going to be doing, with folks? I don't.
So we know at the hotels and the motels now, if they're not necessarily engaging in services or accessing services, and we talked before this about how can we get the word out. So those positions would be able to do that. They'd work with the families to ensure that there's a case plan, that they're engaging in services, that they have access, they're aware of services that are available. They would be, and we talked about off hours, them being on off hours in case the family members worked.
So, I have to say, this seems like duplication of what our community providers are supposed to be doing. So let me just ask another question. Would there be an expectation that state staff use the HMIS system that we currently have, so that there's an integration of supports for those folks?
So two observations. One, I think that this is a recognition that we have limited capacity in terms of housing navigation currently around the state. And when the Emergency Rental Assistance Program federal funding ended last summer, some of the hotel specific positions were lost and not being able to. So that's.
Yeah, I'm not really questioning the
Okay.
876,000.
Okay.
I'm talking about the 21 positions.
I think that that's something that we can consider in terms of utilizing HMIS and whether or not it would be a development project. So I think we can talk internally and see, would there be, for instance, costs associated with doing that. I think what's challenging now, and again, Deputy Commissioner Gray can step in, but just some of the logistics on the ground at the hotels and having additional presence there, that a housing navigator that may be going in and out, not necessarily always meeting with the hotel staff. Sometimes hotels and motels are not providing spaces for providers to meet with, and so a little bit more of the almost like infrastructure support to help ensure operations.
So I guess I'd be presuming, since you'd be entering into a sort of different relationships with these hotels, that as there would be some sort of, I don't know if it'd be a grant agreement, but some sort of MOU with the hotels, like they actually tried working on a few years ago with BGS involvement. That would mandate some of those things, availability of space and things like that. Would you, and I'm not sure if I'm supposed to be directing this to Deputy Commissioner Gray or whomever, but would you consider these positions to be sort of state level case management positions? Would they have a caseload per se?
would be who was at the hotel, or maybe there would be a couple of hotels depending on how many people were there, but I think I'm trying to think, it's kind of providing that infrastructure, right? Like what we know, there's infrastructure to a shelter, right? Like if there's house rules, those don't exist in the hotel that we have, right? So how do we do that? Are there other things that they're identifying that people need, other services that we need to bring in? And so looking at the model of where did that work well when we have the Blackberry shelter, right? Like how are we making sure that the service that people are getting connected, they need help, determining what the transportation is like. So and have one key department, I think, say it's like it's a dorm parent, or an RA that it's like someone helping you come through the system that exists, but also recognizing that we need people that have expertise of, you're going to help them specifically with housing. That's the housing navigators. These folks are more of like, how are we making sure that we have an environment that is a good environment for everybody to be there, and making sure that the services are connected, because I think that is also something that we've heard is, well, wait, we're hearing from people that they haven't been connected to services. Yeah, there are options for people to not be able to do this. I mean, I think it's also, how are we ensuring, that they, has something changed, and can we help them? It's Everett Vision Economic Services could also go and, but it's not that in terms of like eligibility specialists. So maybe you didn't have, you were pregnant and now you need to add a child. Like, can we bring that service to you to add the child rather than you having to go into our office?
So you would, it sounds like you would anticipate assigning people to particular hotel locations. One or two hotels or whatever, depending upon how many people were there. Go ahead, Representative McGuire.
Yeah, I know we had spoken about this. As I see what the barrier is, the GA Emergency Housing and Coordinated Entry, COC, they operate under different philosophies and infrastructures. We're attempting to try to maintain both of them. We need to make a decision. Because what I see from there, those 21 positions, is to continue operating a GA housing benefit where it's a different. Do people get where I'm kind of going with this?
I understand. And I'm seeing Deputy Commissioner Gray chomping at the bit back there. Yeah, go ahead.
I think when we're talking about the 21 positions, there is still, so we still get fair hearing requests. So we have fair hearing specialists that do that. We have bill payers. We have a whole infrastructure that we've had to have to maintain having over 1,200 rooms at present right now to do this. And so that is it. As we move away from using hotels the way that we're using them now, I think we could see those positions, used in a different way, such as this, right? Like currently EST does not have, with exceptions for regional case managers, people who are going into hotels routinely, because that isn't our scope. Like our scope was to assist people getting rooms. Like that is what we've been asked to do, but we've also, like I'm hearing loud and clear from everyone that they want more support in the hotels. And so this is our way of being able to do a part of that, in particular with the vulnerable population.
Yeah, I want to make sure that we are able to get to the rest of the slides because we only have about 20 minutes. Yeah.
But again, I just want to put this on everybody's radar. We're still utilizing and competing with two systems to address homelessness. Either if we're going to utilize hotels, people on benefits, we got to make sure that those individuals are in coordinated entry, no matter what. And I believe that can get framed that way. I understand we're still going to have to utilize hotels for capacity purposes, but to be able to have those same services that are being expressed that people receive in coordinated entry, the best and most effective approach would be to make sure they are engaged and put into coordinated entry.
Okay, I'm sorry. I just need to do a little schedule adjustment. Our friends from pardon me? Yeah, I understand that. Our friends from Three Squares, and we have community members. This is my fault because I forgot that piece of it and I was thinking we had till noon. to be honest, I feel like we have a lot of stuff. I don't want to flip through the because there's still a lot of stuff on this housing initiative that, and we probably were going to ask you to come back anyway on the housing initiative specifically. And so, I think I need to do that now at this point in time, because there's, people who came from all over the state today. And I don't want to shortchange this because it's a big investment. It's an important step, and we want to make sure that we devote sufficient time to it. So I don't want to just skip through it. What I do want to do is to thank you all for your time and attention today, and to apologize for my lack of schedule maintenance. We knew we were going to have a lot of questions, and thought that 2 hours would be enough, but apparently it wasn't. Thank you very much. We'll look forward to an additional invitation from us in the very near future. Thank you. Thank you so much. Thank you, Lori. Yeah. We're going to transition.
I'll ask you later.
Yeah.
We'll have him back.
Yeah, we'll definitely have him back.
We'll be asking the whole.
We're probably not gonna have Erica back. Let me get through the last.
Is that okay?
Yeah.
Let me find out.
He asked him that question already. They said no, but go ask it again. And ask him how much it is, because I think it's more like 800,000, Dan. Come on in, folks. My apologies.
So I'm not being rude. I have to walk all the way to the pavilion.
For outdoor recreation.
Yeah.
Yes, I'm supposed to be there too, but that's not gonna happen.
I don't want to invite you.
Okay, whatever.
I just sleep there.
Whatever you can, why don't you stay, and then, to allow you time in another 10 minutes. Yeah. Okay, whatever you feel comfortable with.
So I don't want to. Okay.
Okay.
Okay. I just don't want it to happen again.
Gotcha.
I wasn't being.
Okay, come on in, folks. Come on in.
So I'm not sure.
In.
Oh.
Huh? Good morning, everyone. Morning, everyone. And again, my apologies for my lack of adhering to the schedule. I appreciate y'all being here. Members, we are, it is, I don't want to call it Hunger Day, but I'm going to call it Food Security Day at the State House. And so we have folks who've come from all over the state to share the important information about food insecurity in Vermont and what that means to people. So because we're short on time, I'm just going to say welcome and introduce yourselves. Normally we would go around the room and introduce everybody, but I'm just going to say welcome, and please introduce yourself for the record, and appreciate you being here.
Thank you so much, Chairwood, and committee members for your time. For the record, my name is Ivy Enoch, and I live in Burlington. I'm the Director of Policy and Advocacy at Hunger Free Vermont. Would you like me to just begin?
Yes.
Okay, great. So as Chairwood said, today is Three Scores Vermont Awareness Day, or Food Security Day, which I love. And we are all here to really acknowledge this essential program and to ask for your support on requests that together will ensure the best outcomes for people in Vermont, for our communities, for our farmers, and for our economy. I don't need to introduce this program to any of you on this committee, but let me just represent us to the critical impact Three Scores Vermont has on our communities statewide. Three Scores Vermont supports nearly 10% of Vermonters with essential funds for groceries, and more than $12 million are issued to Three Scores Vermont households every single month, making this an effective food security and economic stimulus program. We've heard many Three Scores Vermont participants refer to this program as a lifeline, and in many cases, the only reason they're able to afford groceries. And as someone who was raised by a loving and hardworking single dad whose monthly grocery budget was our SNAP benefit, I know firsthand the power of SNAP to help families get by, to catch up, while still experiencing the joy of a shared meal. I would not be where I am without SNAP. Despite harmful federal changes to this program, which, as you know, went into effect in October 2025, Three Squares Vermont remains our state's most effective and efficient program to reduce hunger and poverty. I know you are very familiar with the eligibility and funding changes passed in HR 1. Compounding these complex eligibility changes that Vermont had to implement in a fast-moving and challenging landscape, Vermont faces additional costs to administer Three Squares Vermont beginning in October 2026. Hunger Free Vermont has been closely following the state's projections regarding increased SNAP administrative costs resulting from reduced federal funding. We are glad that the administration included funding for this and urge the legislature to continue to pay close attention to full funding needed to make sure we keep this critical food security and economic development program thriving in our state. Further, it is critical for Vermont to ensure that all eligible people are able to stay enrolled or be enrolled in Three Squares Vermont. And we note with concern the change in enrollment over the last year, where approximately 4,000 folks are no longer enrolled. And this decrease is more than double the reduction seen from the prior year, and which far outpaces those who lost eligibility in October 2025 because of federal changes. These trends underscore the importance of ensuring administrative funding is sufficient to not only fill in federal gaps, but to actually support access, retention, and program integrity. Not only that, these trends underscore the importance of investing in our state's existing network of benefit assisters embedded in communities across Vermont, a number of whom are also impacted by losses in federal funding. Benefit assisters help people decode complex application questions, understand what documentation is needed to verify their information, and what to expect in the mandatory interview. The importance of this service couldn't be more apparent than when we see major changes in eligibility, like with HR 1. Having benefit assisters at a person's regular, local, trusted service provider organization will improve the chance that everyone who is eligible for Three Squares Vermont will get the benefits they're entitled to. We already have a very strong network of expert benefit assisters, and Vermont is often lifted up as a model for other states. These trained benefit assisters not only ensure a unified understanding of Three Squares Vermont across the state, but actually support our state agency by helping ensure applications are completed accurately, and that reduces administrative burden for our state, and it also supports a low payment error rate. Benefit assisters improve the human experience of navigating paperwork, phone calls, and documents to access basic needs supports like food. And it really can't be overstated that benefit assisters are responding now to many complex program changes and greater needs. Investing in this existing network of benefit assisters at trusted organizations across Vermont will have a multiplier effect by helping eligible people to continue receiving Three Squares Vermont and keeping those federal dollars flowing to our grocers, our farmers, and our overall economy. We all want to ensure the best possible outcomes for everyone living in Vermont, and food security, we know, is a policy choice. And we also know that Three Squares Vermont is an essential part of the pathway to supporting households while we work together to achieve food security for all. There are policy choices in front of you this year that will go far in ensuring the best outcomes for Vermonters in this moment. And the first is to please fully fund the administrative costs needed for state fiscal year 27 to counter federal funding changes and keep Three Squares Vermont available and accessible to people in Vermont. And second, to please support the appropriation of $4.95 million in fiscal year 2027 for benefit assisters for SNAP and Medicaid. Thank you very much.
Thank you. Thank you very much. And as you said, we're pretty familiar with Three Squares in here and appreciate your very specific recommendations to us. And are you Catherine?
I am.
Well, welcome.
Thank you.
Welcome. So we're happy to have you here today. The floor is yours.
We're going to do some musical chairs here.
Sure.
Catherine, I'm not being rude. I just had a prior commitment. Okay.
Oh, that's all right.
Thank you. Good afternoon, everyone.
And other committee members, I hope you're able to stay a few minutes into the lunch hour, if that's okay. Thank you. Thank you. Go ahead, Catherine.
I just want to say thank you on this beautiful, beautiful day. Sunny day. My name is Kathleen McBride, and I live in South Burlington, Vermont, with my young granddaughter who's there. My driver. A very important part. My granddaughter is 16 years old, and we are here to celebrate the importance of Three Squares Vermont and to ask you to fund the necessary administration costs to operate Three Squares in our state for the state fiscal year 2027 to counter federal funding changes. Full funding for Three Squares administration is critical to keep this program available for all who are eligible in Vermont. If you can't hear me, let me know.
You're doing fine.
As a retiree on a limited fixed income, after working many years teaching, I now take care of my young grandchild full-time. And it's certainly a struggle financially. The struggle is real. I love my granddaughter dearly and will try my very best to support her to do well in school so that she can one day contribute productively to our economy and local community. She is a wonderful, kind, thoughtful, and polite young girl who is a huge help, Grandma. I patiently helped her get her driver's license last February. Now she does most of our errands, except groceries and medicine. Aroha has been an honor student for 3 years at South Burlington High School, after spending many years in China with Grandma. She takes Chinese lessons every Friday evening and participates in track and field, cross country, and is an active member of the Civil Air Patrol at the Burlington Airport. She aspires to be a pilot. So she can still drive Grandma places.
Great, thank you.
Each month, I prioritize what I absolutely need to pay, be it dental bills, dental insurance, medicine, medical insurance, not covered by Medicare, unfortunately, medical bills, car insurance, vehicle registration fee, state vehicle inspection, gas, repairs for cars, house repairs, house fuel, condominium dues, electricity, telephone, Wi-Fi, and food. Every year, the amount of my Social Security check goes up. A small percentage, but unfortunately, our household expenses often exceed that increase, unfortunately. The temperature in my home is always kept at 57 degrees, which is quite comfortable. In China, I had no heat in my classrooms. We just learned to dress properly. We close the bedroom doors during the day to keep expenses to a minimum. We turn our lights on after the sun goes down and shut off breakers at the main box for unused appliances. I struggle each month deciding what I can go without. We've become very conservative. We buy used clothing, used shoes, and used household items that we need. I cook from scratch. I do not buy prepared or packaged food, as it is very expensive here in America. I sew, mend, or darn torn or broken items, which I enjoy. I do my own household repairs, including plumbing, electrical, carpentry, painting, and I still can do some car repairs. I was able to troubleshoot my 13-year-old Avana refrigerator, and it stopped keeping our food cold on Google. I found the part on Amazon for $29. It took me less than 1 hour to replace it and to vacuum the coils in the back. I did need a little help pushing it back in. It was back up and running within 2 hours. All skills that I learned from my wonderful dad, who could fix anything. Receiving 3 Squares has been a tremendous help to us. We can buy fresh, healthy food, yogurt, vegetables, fruit, fish, meat, and sometimes some bread, for which we are most appreciative of. I want to give a giant shout out and of thanks to the Vermont Food Bank, especially Ariana Matthews Salzman, for her kind assistance in helping us. Secure three Squares Vermont. Without Ariana's assistance, this would not even have been possible. We are forever grateful. I tried to navigate the state maze for many months and only received more paperwork and rejection letters. After returning back to America from teaching overseas for many years, this went on for many months. The data we received back was often incorrect, unfortunately. Our files were mixed up with another family. The paperwork showed additional members living at my house. Only my granddaughter and I have ever lived there. Misspelled names despite completing the paperwork and sending it in multiple times. I would call, be put on hold, transferred, and then the call would drop. I finally resorted to going down to the local office in Burlington to talk to a real person with my 3 Squares file and our IDs. 2 folks in the Burlington office, Angel Iracosi and Denise, were very, very polite, kind, present, and helpful. We had to rely on the local food banks and family to survive when we returned from overseas until I could receive my Social Security. It was beyond frustrating and discouraging. I often went to bed hungry at night. I encourage you to think about how to create solutions that work for people, particularly people on fixed incomes like me, to make sure that we can get the food we need and pay our bills. That means fully funding the 3 Squares administrative cost so that people who are there to help us apply for the program are well-trained, patient, respectful, and kind. It means fully funding Vermont Food Bank's requests so that I can use food shelves when I need to. Thank you for your attention and your support of these critical programs that help people like my granddaughter and me. Thank you very much.
Thank you so much, Catherine. Thank you. I know, I just want to send out appreciation to you because I know it's really hard to share, a personal story like that with a room full of strangers, and that takes a lot of courage to do that. And I just, want to send tremendous thanks to you and to your granddaughter. It's lovely to meet you too.
My wonderful assistant. So she'll be flying me around.
Oh, well, you'll be going to far off places. That's wonderful. Thank you so much for being here.
Thank you.
Now we're going to move to an update on immigrant eligibility from Molly Gray and Drukshan Farshad. Farhad, okay, thank you. Thank you so much for being here. Take care of you. Welcome.
Hi, everyone. Realizing we're maybe their last testimony before lunch, so.
And we're talking about food.
And we're
It's
talking
okay.
about food,
Good. All good.
But thank you so much for having us. My name is Molly Gray. I serve as the Executive Director of the Vermont Afghan Alliance. Drukshan Farhad, Drukshan, people call you D. Farhad is joining me today. Drukshan was one of the very first employees at the Alliance. the first Afghan woman to graduate from Norwich University.
Yay.
And today runs our health and wellness program, which has also involved helping folks complete their SNAP applications and then navigating this really challenging period this fall, as this committee well knows. And we did not come with a legal PowerPoint today. You're welcome. Patricia really knows the complexities of what it has meant to have folks lose SNAP, then to try to get reinstated on SNAP. And we want to talk a little bit about some of the challenges there. I just want to be clear, we don't lobby, we're apolitical, we're nonpartisan, and thank you for the invitation to provide an update. And then I wanted to speak at the outset and just discuss or shine a light on the population that still doesn't have SNAP access, and to make sure that that's really clear for this committee. So as you know, HR 1 ended SNAP for anyone who is not a legal permanent resident, green card holder. Right? And then there was this question around, did refugees and asylees have to wait for 5 years? And thank goodness for this committee and your leadership and everything that was done to help that process get clarified. In December, it was clarified that if you have a green card, you don't have to wait for 5 years. But the concern that we have is around the population of individuals who are asylees or refugees who do not yet have their green cards. And those are really people who have arrived, in most cases in the last 5 years under the Biden administration. These are Afghans, many members of the Afghan community statewide, and then other refugee or asylee populations. And the concern is that the state in implementing HR 1, and HR 1 made it clear, like this population is no longer eligible for 3 squares Vermont, started a wind down process. So they gave refugee organizations serving these populations a little bit of money to first provide 1% of food access, and a smaller percentage, with food access completely ending in January. So this population no longer has access to food through the state of Vermont. Yet the situation for them has not changed. There are still individuals who may have a disability. There are still moms who have kids. There's still individuals who are working 1, sometimes 2 jobs, but still aren't making enough money to pay the bills and to pay for food, just like any other Vermont family. So we want to flag that because I still think that there's something that could be done to ensure that every Vermonter has access to food, right? Not just those who have a green card. And I think that could be creating some sort of state benefit, I don't know what you call it, Food for All Vermonters program. I don't know what it's called. Making sure that in the 3 Squares Vermont drop-down menu, I haven't seen the computer system, but can it be paid for out of state dollars rather than federal dollars, right? So there's no issue with federal funds. So we're concerned about that. And we're also concerned about that because if someone doesn't have access to 3 Squares Vermont, they don't have access to any other programs or benefits that use 3 Squares Vermont as a qualifying benefit. So Crop Cash, right? Which Nova has probably testified to you about, which is an incredible program, making sure people can access fresh vegetables or farmers markets. LIHEAP, for example. So the tack-on impact is significant. We don't have the answers today on the amount of money. I think that's a question for economic services. I think they could give you the data because they are the ones who pulled people off of that benefit. I will pause there. So I just wanted to flag that. And then we wanted to really talk about just some of the challenges over the last couple of months in getting people reinstated. So this committee is aware of some of the bumps in the road for those who are now re-eligible.
And I appreciate hearing about that because honestly, what happened didn't need to happen. And that's very frustrating, I can say. Our state government acted precipitously in making decisions that we frankly in this committee had heard plenty of testimony to understand were wrong. And they were proven wrong and they had to reverse them. And thank you for describing what that's been like for people to try to re-engage with something that shouldn't have ever been taken away to begin with. Thank you.
Thank you so much for having us today. I'm going to talk about some of the challenges or my experiences over the last couple of months with the Economic Service Office. So my understanding of what I have over the past couple of visits I've had for kind of navigating some of the cases for my clients, over 30 visits, I would say, for 5 different cases. There are some inconsistencies of operations, and my understanding is that the changes in the law, not every single staff or all the staff have been briefed about it, so you hear different things from each staff. Our organization helps with resettling SIV arrivals, Afghan SIVs. SIV or special immigrant visa holders are people who have worked with American entities in Afghanistan over the US mission in Afghanistan, and they have risked their lives, and it takes a lot for them to get processed, and it takes years for them to get to this point. And upon arrival, they are basically residents or green card holders. They might not have their green cards in hand, but it arrives in the mail. There's no need for adjustment of status. So when we had a couple of families during the time when our state interpreted the law in a certain way, where a lot of the SIVs, all the SIVs were deemed ineligible, it meant our organization had to come up with an emergency solution. So for a short period of time, we were doing something in terms of some funding to very limited funding for the individuals to have some money for food, because 3 square was no longer an option. But as soon as we heard that the rules were changed and they were like basically SNAP was reinstated again, I rushed to economic services to get everybody signed up. And I experienced many different interesting things. For the first couple of times, the first 2 families that I took there, and I made sure to sign the authorized representative form so they could talk to me and I could even be part of the interviews and the entire process. The first time I went in there, they almost turned us away because we didn't have a green card in hand. But I was sure about the law that their visa, the visa that was on their passport, served as a green card, or it had every single information that you would find on a green card. The caseworker was not sure what was going on, and probably one of the very first times when I had to ask for a supervisor. And when the supervisor came, even the supervisor didn't know if it was possible, to which I had to call Molly and be like, Molly, they're almost about to turn us away. And then she was like, no, we are right. We know this has to happen. So I had to insist and be like, is there someone, like, do you have a supervisor? I need to talk to them. And then there was a senior supervisor who was like, yes, I think we can do it. We have not done it before this way, but we know it's possible, because they were like, we need an A number ID. I'm like, it's here. You can find the number here. So I had to like consistently push back, and that was exhausting. But then there was another instance where we went to the interview. The client was eligible. Absolutely. She had her green card. And the caseworker said, well, how long has she had her green card for? Does she meet the 5-year requirement? I'm like, that has changed. That's no longer like necessary. And she said, okay. But I guess she wasn't sure about it, because when the next day I went in, they said she's not getting SNAP benefits because she doesn't meet the 5-year, like having the green card. And I'm like, that's wrong. I had to fight back. So it's just like going back and forth, because like all these, you never knew which caseworker, which supervisor you're going to get. Or in another case, when we had done the interview in the past, so like when you submit an application, if laws change, when you go back, you can go back to the first date that you submitted an application. But because they thought that she didn't complete the whole process, submitting application and then doing an interview, they were not going to count that, where I had to go back and correct them that she did an interview. In fact, she was there to answer questions, but the caseworker was like, no, the law has changed. You should just probably leave.
And then they were like, but if she had completed the interview, I'm like, she did, but you told her not to complete the interview. So I'm gonna hold you for it because this is not right. And it was like every single day, all these visits were I had more than 30 visits, but it was not for 30 individuals. These were just 5 cases that I had to constantly go back and forth to the point where the security guards were just like getting familiar with me.
You're saying hi.
Yeah. So I have made friends and they know even that which day was a successful day, but it was really hard to know what person you're gonna get that day. So I think I would recommend if the DCF could get some training on the changes and get every staff up to speed and updated about the laws, because I had the time and I was the authorized representative to spend more than 30 hours for 5 cases, but the clients cannot afford that. And many cases might be eligible and they might be turned away because the person might not know the law.
And I would also say that we receive the state funding to run a health and wellness program, and it's not an excellent use of staff time to have to spend that many hours.
Right, for sure. We have time for a couple questions.
I'm just wondering, the ESD workers, there's a lot of programs and constantly changing guidance. And so I can kind of understand why, they might have trouble. I'm wondering if there were like specific training positions at least that like you all could have the contact information. So when you do, in the meantime, while people are being trained up, that might be helpful. So you don't have to spend 30 hours, that you have a contact,
So like somebody who has been
specialist.
a specialist, right? Particularly since we knew that this was going to be an issue, it would have made sense instead of doing sort of that broadcast thing, if they had, even if you were only able to do it on the phone with somebody or, through a video chat, at least they would have had the specialized training to know what you knew. So you were providing the training to the staff is essentially what was happening. Go ahead.
So do you think but something like that might be useful, at least in the kind of short term?
It's hard to say because when you go, like I have had like some caseworkers where I ask them for like certain to understand the law, and they're like, one time I asked a caseworker and he was like, we have an app for 3 Squares, but we don't get the name. And I'm like, if you're a caseworker and you don't get the name for the app that people can use for 3 Square, who gets it? And he's like, well, that's a higher level thing. And then when I spoke to some of the supervisors, they were like waiting on some staff in Waterbury, Vermont to make some decisions. So sometimes, and they're very like kind of touchy about sharing their email. So they wouldn't share their email even at times. So it was really hard. And sometimes it felt like everyone sort of waited for someone else who was not at reach. At least that's what I gathered. Yes, they were very kind and they were nice about it, but there was a sense of helplessness, which seemed like everyone kind of was like it was out of their hand.
There was a specific lack of willingness I sent the supervisor letter. I said, can I have your email? I'm going to send you over the USDA guidance and make sure you have, because I was like, it sounds like that has not been communicated. But yeah, I would say that I was not comfortable, but they, so, but it's, it's an area of, I think hopefully it will be resolved, but it has not been an easy process, certainly.
And then my one other question is my understanding for this group, that got their benefits reinstated is that when they were kind of going through the process to get re-enrolled, they counted these month or 2 of funds that organizations like yourself
as income
were providing as this stopgap measure as kind of ongoing income, which then brings down the amount of their monthly benefit. So that's happened, and that's something, folks are still,
we didn't know how long this process was going to go on, where people were going to be in this gray zone of not knowing whether they were eligible. And so we were providing bi-weekly payments, and also it's like running like a SNAP-like program through our organization while working to find people housing and employment. And just a reminder, for new arrivals, SNAP is like a 90-day support until someone gets a job and then they're off. So this isn't a long-term process. It is a longer-term benefit for moms with kids and individuals, just like anybody else who's on SNAP who has a qualifying economic experience. Yeah. And I just wanted to just shine a light on one more point that I think is really important right now. I'm sure everyone in this committee has been watching what happened in Minneapolis and also Maine. And the target of those operations is really around Operation Paris, Parris, this effort by the Trump administration to re-vet or reevaluate refugees and asylees who came in under the Biden administration. And that is the same population that in Vermont has lost SNAP benefit. And these are Afghan veterans and allies. These are people who risk their lives for our government. So not only are they losing, they've lost their food security, but they're also deeply concerned for their safety here in the state. And so it's just like it's the state is piling on something that shouldn't, in my view, should not be food should not be a security concern right now, right? Vermont made a choice to welcome refugees and asylees, to resettle them. They're our newest neighbors. And so it's just overlap with the immigration concerns that we have. They're quite significant.
Makes me feel very unsafe.
Yeah, exactly. Yeah.
I totally understand that. And I'm proud of what our committee did to try to take action when we knew it was the right thing to do, and we knew that what was happening at the state level was not the correct thing. And in the end, whoever the legal powers were that, made that happen at the federal level, we're grateful, but not grateful that people had to go through all of and are still going through all of the issues that they're going through. Especially when it didn't have to be that way. So thank you both for being here this afternoon. We really appreciate it. And thank you for what you're doing to help, other folks out there.
First time testifying.
Oh, for sure. Thank you so much.
Thank you.
All righty. And thank you, committee, for staying a few extra minutes to hear testimony. And I apologize for my lack of agenda. Okay, we're off till